Hello, I'm Alma Angeles. Thank you for joining us tonight. These are unprecedented and indeed interesting times. Events unfold and change by the minute. And as the days go by, we watch as our leaders cope with relentless march of this virus and the disease. Now to the news. The Iglesia ni Cristo, or Church of Christ, once again extended help to the Quezon City government by donating 13.2 million pesos worth of personal protective equipment, vitamins, disinfectant, and other hospital needs for the city's frontliners. Here's Erlo Bringas for the details.
For the second time, Iglesia ni Cristo extended help to the Quezon City government by donating 13.2 million pesos worth of personal protective equipments, vitamins, disinfectants, and different kinds of hospital needs for the frontliners of Quezon City. INC General Auditor Brother Glicerio Santos Jr. said that the donation made because of the directive of INC Executive Minister Brother Eduardo V. Manalo to support healthcare workers frontliners in Quezon City that also fights against COVID-19.
At nung isang araw nga ay may tumawag sa amin na ospital na umiiyak na sana raw sila matulungan. Kaya ang ginawa ng Eduardo, noon din na may tumawag ay nag-utos siya sa amin na bumili ng mga gamit. Ilamang itong mga binibili natin mga gamit, napakahirap na magbilin. Kaya inabot ng 2 linggo halos bago namin natipon yung mga pangangailangan nila. Ito ay alang-alang sa mga frontliner na kitang-kita natin na hirap at ibinibigay ng kanilang buhay para sagipin ng marami nating kababayan. Na sana ito kahit bahagya ay makatulong sa ating mga doktor, sa mga nurses, sa mga paramedic na talagang bigay ang buhay nila. At sana itong mga ganitong pagkakataon ay magtulong-tulong tayo.
The donation included the following boxes of thermal scanners, surgical gloves or cuffs, gallons of alcohol and PPE equipments, and different medical needs for the hospitals in Quezon City. Weeks before, the INC also donated 5 million pesos to the Quezon City government to help in aid to the Quezon City residents affected by the COVID-19 and enhance community quarantine. INC also donates 3 million pesos to Davao City government and allowed the use of the Philippine Arena and the Ciudad de Victoria facilities to be a mega quarantine facility for COVID-19 patients.
At ito namang ikalawang donasyon ito ay nabalita ni Ka Eduardo na napakarami nating mga frontliner sa mga ospital, lalo na sa mga government hospital, na nahihirapan dahil sa kakulangan ng mga gamit, kakulangan ng mga gagamitin nila sa ospital. Ito ay awa at tulong ng ating Panginoon Diyos na mula pa sa panahon ng kapatid na Iranyo Manalo, maging sa lalo na ngayon sa panahon ng kapatid Eduardo Manalo, na totoo napakaraming kalamidad at napakaraming naghihirap, napakaraming naging biktima ng mga kalamidad ay bukas ang puso ng ating pamamahala. Ibigin mo yung kapwa-tao. Yan ay pangungusap mismo ng ating Panginoon Diyos at ng ating Panginoon Kristo. Kaya itong sinasabing ito ng Biblia, na tulungan ng tao, kapwa-tao, na papanahon ngayon. Kaya ang Iglesia ni Cristo mula pa 2 tuntunin, maglingkod sa Diyos at tulungan ng mga tao. Yan ang nagbunsod sa Iglesia ni Cristo.
The Quezon City Mayor Joy Belmonte says thank you and send gratitude to Brother Eduardo V. Manalo and for the church for these new donations that will benefit all the frontliners in the city. She also assured the public that the equipments will send it to all frontliners in different public hospitals in Quezon City.
Ay super important. Gusto ko lang pong magpasalamat because yung INC po, never po tayong pinabayaan, never po tayo iniwanan, lagi po kayong naandyan. Kayo po ang laging unang nagbibigay ng saklolo po sa atin pong mga mamamayan. Sa lahat ng panahon, gusto ko lang pong i-assure ang kapatiran na lahat ng kanilang pagmamahal na ipinakita po sa ating lungsod sa pamamagitan po ng tulong na ito ay taus-puso ko pong binibigang halaga at pinapasalamatan at makakaasa po kayo lahat ito ay makakaabot sa mga iba't ibang mga tao, komunidad, barangay, sektor na nais po ninyong maabot.
Brother Jun Santos also assured the public that the church also provide aid to those in need, whether or not they are member of the Church of Christ.
Ito ang panahon na tayong mga Pilipino, lalo na yung mga may kaya, ay magkaisa tayo. Magkaisa tayo, natulungan yung mga ganitong mga nangangailangan. Hindi lamang yung mahihirap. Itong mga frontliner na ito, nakikita natin bigay ang buhay. Kaya kung merong mga tao na dapat nating damayan, isa yan, mga frontliner natin. Kaya sana makatulong ito kahit bagya sa kanila. At yun naman ang larawan ng isang namamahala na malaki ang puso sa pag-ibig sa kanyang kapwa. Yun ang nasa Biblia. Kaya mula't mula pa, ano man ang mangyari, ano man ang dumating na sakuna dito sa mga bayan sa Pilipinas, kaagapay lagi nila ang Iglesia ni Cristo. Sa pangunguna ng ating tagapamahalang pangkalahatan ng kapatid Eduardo Manalo.
Higit sa lahat sa mga nagmamahal at nagpakita ng pagkalingat pagtugon sa ating mga pangangailangan ay ang INC. So my deepest gratitude, taus-pusong pasasalamat ay at akin pong nais na ipagkaloob po sa inyo ngayon. Marami po salamat.
For Iga News, Arbingas, we live in interesting times.
To the U.S. now, governors appealed to the White House for a national strategy against the fast-spreading coronavirus as deaths surged and health authorities warned the coming week could resemble a Pearl Harbor moment. President Trump aimed to emphasize progress in the fight, including plans to send hundreds of thousands of masks to counties in New York, but could not sugarcoat the difficult weeks ahead. Let's listen in.
And we'll continue to do it as it really gets. This will be probably the toughest week between this week and next week. And there'll be a lot of death, unfortunately, but a lot less death than if this wasn't done, but there will be death.
U.S. Surgeon General Jerome Adams sounded an even more dire alarm. He said this is going to be the hardest and the saddest week of most American lives, quite frankly. He told this to Fox News. He added, this is going to be our Pearl Harbor moment, our 9/11 moment, only it's not going to be localized. Most of the nation is under shelter-in-place orders, but 9 states have yet to issue such regulations, while the federal government has declined to mandate anything on a national level. Now, Adams noted that the 9 states without orders were producing much of the U.S. food supply. Still, he pleaded with state leaders to urge residents to stay home for at least the next 7 to 10 days. He said there is a light at the end of the tunnel if everyone does their part. More than 1,200 people have died of coronavirus complications in the U.S. in the past day, according to Johns Hopkins University on Sunday evening at 8:30 p.m. EST. The Baltimore-based university, which has been keeping a running tally of global coronavirus numbers, said there are at least 337,072 confirmed infections in the U.S., with 9,633 deaths. The president and other members of the task force sought to assure the public that the country may be close to getting through the worst of the pandemic. Dr. Anthony Fauci noted that data showing death tolls and hospitalizations often have a 2-week lag time. He said the country will likely see the benefits of its actions today in the weeks to come.
Okay, so part of the answer to your question, I think, relates to 2 other questions I heard, and I think it came from the back about how can you, on the one hand, have said yesterday that this is really going to be a bad week at the same time that we're talking about the light at the end of the tunnel. It seems to be inherently contradictory, but it really isn't. And it has to do with what we explained before about the lag in when you look at the indications that Dr. Birx and the President was talking about, where you see a flattening out of cases, and you don't see the realization of what that means until 2 weeks later. So right now, we're seeing, as we all said correctly, that this is probably going to be a really bad week. That is a reflection of what happened 2.5 weeks ago. So if we start seeing now a flattening or a stabilization of cases, what you're hearing about potential light at the end of the tunnel doesn't take away from the fact that tomorrow, the next day, it's going to look really bad. So we've got to make sure we realize we're always talking about a 2.5-week lag. So I want to make sure, because I think a couple of people asked that question. It's really not incompatible with what we're saying. Now, with regard to what do we tell the American people, Kelly, what we've been telling them all along, that the only tool, but the best tool we have is mitigation. We know it worked in other countries, and we're seeing how it's working here. So if we really want to make sure that we don't have these kinds of rebounds that we're worried about, it's mitigation, mitigation, mitigation. That's the answer.
When new cities and new states come on the chart,
Yeah.
what's the message for people in those places that have not been the focus?
It's the same thing. It's mitigation, mitigation, mitigation. In fact, the famous Vice President chart is that this is the minimal of what we should be doing. You know, everyone should be doing that. And everything on here, one way or the other, points to physical separation. Whether it's no crowds, whether it's 6 feet, whether it's staying away from theaters and restaurants or what have you.
And churches and places of worship.
Exactly.
Doctor, are you worried at all about people becoming complacent, though? Are you worried? I mean, because a couple of days of this, I think people are about ready to go nuts staying in their house. And I'm just curious, are you worried at all that after, 7 days from now, people are going to say, look, I gave it my best shot, but I got to get out? I mean,
I wouldn't say I'm worried about it because I don't think it's going to happen. I mean, from what I've seen, and I mentioned it the other day, my own experience, is that people really understand the responsibility that they have for themselves, for their family, and for the country. So this is about all of us. This isn't just about us. Because if everybody does their part, you are going to not have those kind of rebounds that we're worried about.
Dr.
Meanwhile, Dr. Deborah Birx said that health experts are looking towards Italy and Spain and seeing the countries start to turn a corner. Take a look.
Their serology is now about 36% positive. They were in the 40s. So day over day, their percent positive is finally starting to decline. But as we started, we just wanted to note again, we do see hopeful signs in Spain and Italy. They have completed nearly 4 weeks of mitigation with people really doing social distancing, staying at home, ensuring they were washing their hands. If they have to go out to the grocery store, they're extraordinarily careful. They send one person from the family. And so we can really see that beginning to work, and we're very hopeful that over the next week, although we'll see rising number of cases of people who lose their lives to this illness, we're also hopeful to see a stabilization of cases across these large metro areas where the outbreak began several weeks ago.
A tiger at New York's Bronx Zoo has tested positive for COVID-19, according to the institution, and is believed to have contracted the virus from a caretaker who was asymptomatic at the time. Now, the 4-year-old Malayan tiger named Nadia, along with her sister Azul, 2 Amur tigers, and 3 African lions all developed dry coughs and are expected to fully recover, according to the Wildlife Conservation Society that runs the city's zoos in a statement. They said, we tested the cat out of an abundance of caution and will ensure any knowledge we gain about COVID-19 will contribute to the world's continuing understanding of this novel coronavirus, the statement said. It added, though they have experienced some decrease in appetite, the cats at the Bronx Zoo are otherwise doing well under veterinary care and are bright, alert, and interactive with their keepers. All 4 of the zoos and the aquarium in New York, where the virus death toll has topped 4,000, have been closed since March 16. The zoo emphasized that there's no evidence that animals play a role in the transmission of COVID-19 to people other than the initial event in the Wuhan market, and no evidence that any person has been infected with COVID-19 in the U.S. by animals, including by pet dogs or cats. A deadly Pacific cyclone intensified as it hit Vanuatu on Monday, threatening a natural disaster that experts fear will undermine the impoverished nation's battle to remain coronavirus-free. Tropical Cyclone Harold, which claimed 27 lives earlier when it swept through the Solomon Islands last week, strengthened to a scale-topping Category 5 superstorm overnight. That is according to the Vanuatu's Meteorology Service. The cyclone is now packing winds of up to 235 kilometers kilometers per hour, or 145 miles per hour, prompting the Red Cross alerts across several provinces. It made landfall on the remote east coast of Espiritu Santo Island on Monday morning and was heading directly for Vanuatu's second largest town, Luganville, which has a population of 16,500. The slow-moving storm is expected to pass north of the capital Port Vila early Tuesday. Another concern is the impact a large natural disaster could have on Vanuatu's attempts to remain one of the world's few countries without any reported COVID-19 infections. The nation has sealed its international borders to avoid the virus, but emergency measures, including bans on public meetings, have been temporarily suspended so people can gather in evacuation centers. New Zealand Prime Minister Jacinda Ardern raised concerns about the cyclone, and she said the Kiwi military was ready to deploy if needed, even though New Zealand is on COVID-19 lockdown. And France is likely to see its deepest recession since the end of World War II this year because of the coronavirus crisis. That is according to Finance Minister Bruno Le Maire. The worst growth figure in France since 1945 was negative 2.2% in 2009 after the financial crisis of 2008. He said we will probably be very far beyond negative 2.2% this year, he told a Senate panel. He also said it's an indication of the amplitude of the economic shock we're facing. France imposed a nationwide stay-at-home order from March 17 after shutting all non-essential businesses. Officials have said the lockdown will last until at least April 15. Statistics Office NC said last month that the lockdown has slashed overall economic activity by 35% and estimated every month of shutdown would cut annual GDP by 3 percentage points. In a rare special televised address, Queen Elizabeth II thanked the healthcare workers on the front line of the fight against the coronavirus outbreak and sent a message of hope to people, excuse me, to people forced to separate from family and friends. Take a look.
I'm speaking to you at what I know is an increasingly challenging time, a time of disruption in the life of our country. A disruption that has brought grief to some, financial difficulties to many, and enormous changes to the daily lives of us all. I want to thank everyone on the NHS frontline, as well as care workers and those carrying out essential roles, who selflessly continue their day-to-day duties outside the home in support of us all. I also want to thank those of you who are staying at home, thereby helping to protect the vulnerable and sparing many families the pain already felt by those who have lost loved ones. It reminds me of the very first broadcast I made in 1940, helped by my sister. We as children spoke from here at Windsor to children who had been evacuated from their homes and sent away for their own safety. Today, once again, many will feel a painful sense of separation from their loved ones. But now as then, we know deep down that it is the right thing to do. While we have faced challenges before, this one is different. This time we join with all nations across the globe in a common endeavor, using the great advances of science and our instinctive compassion to heal. We will succeed, and that success will belong to every one of us. We should take comfort that while we may have more still to endure, better days will return. We will be with our friends again. We will be with our families again. We will meet again.
Meanwhile, the coronavirus pandemic has killed more than 50,000 people in Europe, mostly in Italy and Spain, France, In Britain, that is according to an AFP tally using official figures at 09:45 GMT on Monday. With a total of 50,209 deaths, Europe is the continent with the most COVID-19 fatalities out of 675,580 declared cases. Hardest hit Italy has 15,877 deaths and Spain 13,055. France has reported 8,078 fatalities, while Britain has 4,934. Meanwhile, Spain declared Monday a fourth consecutive drop in the number of coronavirus-related deaths, with 637 over the past 24 hours, the lowest number in nearly 2 weeks. Fatalities, which were sharply down on the record 950 on Thursday, brought the total deaths in the country to 13,055, second only to Italy. The official figures represent an increase of 5.1% over the last 24 hours, compared to a 4.8% rise on Sunday and a 32.63% leap as recently as March 21. The number of infections or new infections also slowed down, rising 3.3% to 135,032, down from a rise of 24.8% on March 21. Health workers in Alberta are facing stigma and evictions as residents scramble to distance themselves from perceived risks of infection. We have more from Thomas I. Likeness.
My update from Alberta, Canada today is not going to be about numbers. It's not going to be about patients. I want to focus on the people we too often take for granted, the men and women who go to work every day in healthcare settings. Now let's talk for a bit about the people who work in these hospitals. They're putting their lives at risk to save the lives of others. And I heard something very disturbing the other day from our Chief Medical Officer of Health, Dr. Dina Hinshaw. It's hard to believe that some people think like this.
I have recently heard disturbing reports of healthcare professionals experiencing discrimination due to the fear that they will be more likely to carry the virus. This discrimination even includes threats of eviction from their homes. I assure you, these trained professionals are going above and beyond to stop the spread of the virus, both at their workplaces and in their homes.
Now, I just don't understand that kind of thinking at all. Let's take a moment here to hear from a nurse. Her name is Mila Kallio. In a video interview I did a little while ago, I asked Mila what she does when she goes home.
So, and then before getting into the house, I have, in the stairs that I could leave the shoes and then I could go into the washroom. I remove my whatever clothes that I'm wearing. Me and Brother Ron will remove that. And then I'll put that in our washing machine right there and there. And I have to hand wash and I have another set, alcohol in my washroom. Yeah. And if really needing, if I need to kind of go another shower, then I have to do that. But it all depends on what I have done for that day.
Now, that procedure is routine for anybody working in a healthcare environment these days. They know the dangers. They're not about to put their families or others at risk. So if anybody is worried because their neighbor works in a healthcare setting, listen to what Mila deals with.
I know the fear is in front of us, but who will be there, to take care of all the seniors or the clients, right? So it's quite tough, actually. It's very tough.
Before I wrap up today, I want to recognize some of the people from Edmonton who are taking care of the sick, whether their patients have COVID-19 or some other illness. These folks here work in an Edmonton medical clinic. Jamel Rhoda is a nurse in an Edmonton hospital. Loida Cruz and a co-worker are shown here staffing this medical clinic. Army Louboutin is preparing food in a city seniors home. These are the soldiers on the front line in the war against COVID-19. They're the ones taking the risks. We do our part staying at home so that the enemy does not advance further into our population. As always, I wish you good health. Take care of others and take care of yourselves. Remember those who are taking the risks for us. Stay home, stay safe, and stay tuned to Eagle News for accurate and balanced coverage of the COVID-19 pandemic. In Edmonton, Thomas I. Likeness, Eagle News. We live in interesting times.
Thank you, Thomas. Eagle News. We'll be right back.
Alamin ang tamang paraan ng pag-ubo upang mapigilan ang paglaganap ng Coronavirus Disease 2019. Ugaliing magdala ng panyo o tissue. Kung uubo o babahing, takpan ang buong ilong at bibig gamit ang panyo o tissue. Kung walang dalang panyo o tissue, maaaring gamitin ang braso na pantakip. Kung nakararamdam na kailangan umubo o bumahing, agad na dumistansya sa mga tao sa paligid. Huwag dumura kung saan-saan, gumamit ng tissue at itapon sa basurahan. Ugaliin ang paghuhugas ng kamay at paggamit ng alcohol o hand sanitizer upang mamatay ang mikrobyo. Basta't sama-sama at laging handa, kaya natin to! Isang paalala mula sa DOH, PCOO, KBP at ng himpilang ito.
Mula noon hanggang ngayon, gabay natin ang MTRCB ratings sa matalino at responsableng panonood. Sa tamang pagsunod sa MTRCB ratings, ginagawa nating ligtas at makabuluhan ang panonood ng bawat miyembro ng pamilyang Pilipino. Lumipas man ang panahon, hanggang may pamilyang Pilipino, andyan ang MTRCB.
Alamin ang mga dapat at hindi dapat gawin ngayong panahon ng Enhanced Community Quarantine dahil sa banta ng COVID-19. Manatili sa loob ng bahay. Mag-assign ng isang tao sa pamilya na bibili ng inyong pangangailangan. Huwag kalimutang magdala ng ID, quarantine pass, delivery receipt, at iba pang dokumento sa paglabas. Maging magalang sa mga otoridad sa checkpoint. Huwag gumala at tumambay sa kalsada. Huwag ding magkumpulan, physical distancing ang kailangan. Dahil sa masela nilang kalagayan, huwag na huwag palabasin ang mga buntis, senior citizen, at mga may sakit. At huwag pabayaan ang sarili at kalusugan. Stay healthy, kabayan! Basta't sama-sama at laging handa, kaya natin to!
Welcome back. The Japanese government may declare a state of emergency this week to contain the coronavirus outbreak. Joining us live from Japan is Lou Omelda Stefan. Lou?
Hi. Just in today, yes, in Japan, the Japanese government has started their final arrangements to declare a state of emergency. The implementation is set to be done as early as Tuesday, April 7th, applicable to 7 prefectures, which includes Tokyo, Saitama, Chiba, Kanagawa, Osaka, Hyogo, and Fukuoka. So this implementation will last for about a month, and this follows the urge made by the governor of Tokyo and the president of Japan Medical Association. So medical experts believe that these 7 areas are the ones where the virus is now spreading rapidly and risking the overloading of the healthcare system. There, Alma.
Okay, so as you said, to clarify, Prime Minister Shinzo Abe cannot just declare a state of emergency as he needs the inputs, and he did, from an advisory panel of medical and public health experts. So he is also required to inform Parliament of this intention. Would you know how the governors will implement this declaration moving forward?
Yes. So Alma, the state of emergency gives the power to the governors to call for restrictions with movement. So they can call for citizens to stay at home, except for what deemed essential activities. And also, for example, buying of essential supply that they can use for their daily life. So they can also call for businesses that attract large numbers of people to close their doors. For example, the entertainment business, department stores, and so on. But the thing is, Alma, there are no punishments if you defy this request. So there are no specific punishments, yes, if someone defies this request. Yes.
Okay. So what does an emergency entail in Japan? Is this nationwide? Is this, or is this specific places only?
Yes, only for 7 prefectures. Like what I mentioned a while ago, this includes the biggest cities, and actually this it was based on the medical experts' advice that these places are the ones experiencing rapid increase of cases. Yes.
Okay. So, can you give us a picture of how Japan looks like now?
So, I actually, if you go out now, it looks almost the same, but less people. Okay. Since this state of emergency will be announced tomorrow, public transportations are still expected to continue running, but limited. And shops and other businesses might still remain open. So under the Japanese law, Alma, the Prime Minister Abe can only declare a state of emergency when 2 conditions are met. So one condition was met already. So the first condition is a situation presenting a grave threat to the lives and health of the people. The second one is a situation that could cause serious economic damage. So since this virus or this pandemic has already reached that situation, thus the declaration of state of emergency.
And when will it be declared?
Tomorrow, it will be all the information will be given tomorrow, and it will last for about a month, Alma.
Okay. Thank you very much, Lou, for that update. Keep safe, keep alert, and keep the updates coming. Thank you so much for your time.
Thank you so much. This is Lou Melda from Osaka, Japan. We live in interesting times.
Let's now go to South Korea. The Korea Centers for Disease Control and Prevention is reporting 47 new cases of the coronavirus, down from 81 cases a day earlier. And it is the fewest daily infections since its February peak, February 29th to be exact. We have more updates coming in from our EBC correspondent, Christine Jewel Uy. Christine.
Thank you, Alma. Today is the lowest number of COVID-19 cases recorded here in South Korea since last February. There are 47 new cases reported today, giving rise to a total of 10,284 cases, according to the Korea Centers for Disease Control and Prevention, or KCDC. Of the new cases, 11 were reported from the capital city, which is Seoul, due to the overseas travel, and 8 from Gyeonggi Province from St. Mary's Hospital in Uijeongbu. Prime Minister Chung Sek-yun has announced the social distancing campaign to be extended until April 19, closing all the schools, gyms, and some parks, hoping to decrease the average number of new infections per day. However, recently, crowds were seen outdoors over the weekend as the weather gets warmer and cherry blossom starts to bloom. Health authorities advise people to keep at least 2 meters away from each other as part of the social distancing. Also, Chung referred to physical distancing as the most effective preventive measure, saying not only to protect a person but also shows consideration for others. Health authorities are now focusing on the investigation of the growing numbers number of people were diagnosed with COVID-19 after recovery since they identified 41 repeated cases. According to KCDC Director General Jong Un-kyung, they will try to find out whether their testing positive the second time after being discharged is due to virus reinfection or revival.
All right. Okay. So, South Korea saw its lowest, South Korea is doing good with the cases and the flattening of the curve, no? Many countries have implemented testing. Please share with us how valuable this testing has been in your country's efforts to curb the virus.
Yes, so at first we can see that there are many cases recorded of infection here in South Korea, which became bothersome, but only because they also have good testing equipment or system. And because of this, their early detection can help them also to make the patient be accommodated at an early stage, preventing also many deaths.
So you're already seeing a flattening of the curve, and yet the government is still toughening penalties for those who violate self-quarantine. Is this isn't this quite restrictive already, since you're already seeing a flattening of the curve, and yet more restrictive measures are in place?
Yes, that is true, but the Prime Minister just said that they just want to be safe and to prevent the cases from coming up, because if ever that they will not prevent or they will not do the social distancing, they're afraid to be like the other countries who suddenly have a peak of the cases of the coronavirus patients.
What measures are currently in place? Are you on lockdown, or how is it over there now in South Korea?
Yes, so the social distancing campaign was extended again for 2 weeks.
Okay.
So it means that all the schools are still closed and they are still doing online classes.
Okay.
And at the same time, some parks that have too many cherry blossoms, which is very famous during springtime, were already closed to prevent the people from coming in. And at the same time, they also advise the people to always wear mask and always use sanitizers. So when you go to public, so to like department stores or to the schools, you can see many sanitizers everywhere. So you can, so the moment that you enter the building, you have to sanitize, and at the same time, they also have thermal scanners to check whether a person has a fever or not.
Are your groceries well supplied now? No more panic buying like before?
Yes, that was also good in South Korea. We never experienced panic buying.
Oh, okay.
So, yes, we never had run out of any supplies except for the mask before. It was became the supplies was not enough before, since the peak of the cases of coronavirus in infected people. So what happened was when the supplies were not so much, so if you buy that in the grocery stores, it will be like the prices are doubled. So what the government did was they supply this to the pharmacy store. So the people just have to go to pharmacies, and they just have to line up like very long time, but then in the end they can get the supply of the mask that they will be needing.
And also the South Korean health minister has urged vigilance to maintain hard-won gains over there in South Korea. Thank you all. Thank you so much for all that update. Thank you for your time. I know you're a busy woman. Thank you so much. Much appreciated.
Thank you so much, Alma. This is Christine Jiwal Uyabut reporting live from South Korea. We live in interesting times.
Indeed. And earlier, I told you about a rare televised address that Queen Elizabeth II made. She reassured Britons to rise to the occasion, and she also acknowledged enormous disruptions, grief, and financial difficulties during this coronavirus crisis. Also, Prime Minister Boris Johnson was hospitalized due to persistent coronavirus symptoms. We have more updates. We have more updates coming in from London. Ashley Espiritu reports. Ashley?
Hi, Alma.
Hi. Good to hear from you, Ashley.
Good to hear from you too. So yes, in the UK, there are 47,806 confirmed cases, and sadly, there are now 4,934 deaths that have happened, and so we're almost reaching that 5,000 mark. And as you said, our Prime Minister Boris Johnson now has the COVID-19, and just last night was brought to one of the London hospitals for testing. And as you saw there earlier, the Queen broadcasted one of her speeches on the television, and she talked about, she thanked the healthcare workers in the NHS for their consistent sacrifice in dealing with the coronavirus, and she followed it with continuing to follow the government instructions for everyone to continue to have hope and continue to fight this virus. Alma?
Okay, so your parents, they're both frontliners, they're health workers. Can you tell me, how do you feel? Are they with you? Do they come home? How do you feel about them working there in the front lines with this coronavirus? Yeah.
Well, my mom right now, she's at work, and my dad is resting since he just came back from a night shift. And when they're at home, they seem okay. We're always just talking, bonding, but we know that deep inside it's really hard for them. So as me and my siblings, we always try to do our best to make sure we're doing the jobs at home, so that they can all they have to do is rest. So we make sure we do, the chores, we do the cleaning, so that all they have to do at home is rest and then just be ready for work when they have to leave.
Is it hard for you? How do you feel about it? Are you scared? Are you worried? How do you feel about it?
It's scary, definitely, because both of our parents are frontliners. We never know that one of them could get it, as they're both exposed to it. We make sure that we do everything that we can at home to make sure that they don't pass it on to any of us. Right now, they're not self-isolating because, they do everything that they can to make sure they're clean when they come home. So yeah.
And how are they reacting? I mean, I know there was a tsunami of patients over there that was described in the news. How are they dealing with this? How are they telling you about this situation?
Just as you've been hearing for over the weeks, they are always talking to us about the lack of PPE, which is the equipment that they need for the NHS for the healthcare workers. So they're always talking about how there's lack of that. They're also talking about people still going out, not following the government instructions, because if you don't follow it, it can mean an increase in the cases, an increase in deaths. So they're always talking about, reminding us to tell our friends to stay indoors. So that's it.
Okay, so how do you feel about that they're not following the guidelines of the government?
I know that in general, as seen online, but the public are wondering whether these people are taking the virus seriously. So, as Boris Johnson always says in his videos, he always tells us to stay indoors, so that's what we hope that everyone is also doing.
All right. I wish I had more time. I had more questions for you, but I do hope that you stay safe, you stay healthy, and also to your parents. Thank you so much for joining us tonight.
Thank you. I'm Ashley Espiritu, correspondent from London, England. We live in interesting times.
All right, joining us live from Scotland is Divina Morales. Divina is also a nurse, and she's currently in isolation. Divina, how are you?
I'm a bit scared, to be honest.
Okay. Can you tell us what is your situation right now? Why are you in isolation?
Okay. there's somebody who lives with us who works in a nursing home, and she was exposed to COVID positive patients and staff. One of the nurses there, a Filipina, is currently in ICU because of COVID-19. So at the moment, she's on isolation plus other Filipino nurses. And as a protocol, we have to observe that once somebody lives with us, has got the symptoms, then we also have to isolate ourselves. And it's actually longer than the one with the symptoms herself or himself. Because she's on isolation for 7 days, but we will be on 14 days, lest we get the virus infection later.
Okay. So it must be a scary experience for you. But you seem to be well. Are you showing any symptoms at all?
Oh, no, no.
Okay.
Apart from her, we don't have any symptoms, neither my husband nor I.
That's good.
And it's a good thing that we all work in healthcare sector and we know how to observe precautions and to avoid cross-infections. So we see to it that she's isolated in her room. I prepare her food. We disinfect the common toilet after using. And then since we work in the hospital as well, we leave our shoes in the car and spray it with disinfectant. So we do as much as we can to not be infected.
So you know very much the rules since you are a nurse and you know what to do really. So do you have kids with you?
Actually, I
in the
have
house?
two.
You have two?
Yeah, my daughter is asthmatic, so she's also in isolation because of that, just in case.
Are they with you? Are they with you? Okay. So do they live with you or are they separated
my daughter is here,
now?
but my son is over there in the Philippines. Yeah.
Okay. So your daughter, so how do you take care of yourselves then? How do you, what do you do with your daughter since you can't really, what do you do? What do you do? How do you keep yourself separated? Yeah.
Well, it's a good thing that even prior to this pandemic, she's really a homebody. She gets her gadget, she plays in her room, and she talks to her friends here and abroad. So it's not that hard for her. And she only gets down when she gets her food. And also the one with the symptoms, I just put her food outside her door to be safe.
How do you prepare? Who's preparing her food then?
Well, it's as a mother, like it comes naturally that you have something to cook. But since we live here, they are used to like the Scottish breakfast, wherein there's an egg, a bacon, beans, and sausage, something like that. And then from time to time, I cook some Filipino food. And then, or sometimes they just eat cereals. So there's always the presence of the Filipino foods like adobo, sinigang. And when I have a chance to go to Asian store, then I can cook pinakbet. Yeah. All right.
Can you share with us your experience in taking care of patients in these times?
Oh, well, it's really like, let's say, really scary because the supply of the PPE is not enough. And I think the culture has something to do as well, that because they are not really encouraging everyone to wear masks even in respiratory wards, they really run out of stocks. The irony of it is that sometimes you even find those PPEs in mental hospitals. And you know why? It's because they knew for a fact that some patients has the tendency to spit at the nurses. So that's why they have stocks. But the medical wards, they are not really that prepared. And it's hard because this virus, even if some people are asymptomatic, and then no matter how much you take care of yourself, observing the precautionary measures, the cross-infection, and really, if only the PPE are enough, then it will be more reassuring. However, it is not always the case. Because the health sector is not just the NHS. You know, there are care homes who cater for the elderly, and they are actually the ones which are more vulnerable. But it does help when you are really very religious with the constant hand washing, whenever, before and after you attended to a patient, and then you have to really protect yourself maximum, and then, of course, you have to boost your immunity system as well.
And
so
lastly,
you have to eat healthy foods.
That's right. Lastly, my question to you, how do health workers there keep each other's spirits up during these trying times?
Oh, yeah. There are supports here anyway. There's plenty from the government. They have set up helpline. Actually, every Thursday, 8 o'clock in the afternoon. I think it is all across UK. We have that applaud. You know, they go out of their room or their houses, and then give applause to all the health workers throughout the UK. And that's to boost the morale. But then, as for the other sectors, like the shopping, the groceries, there are times allotted for the NHS staff, an hour before the normal opening. So that is entirely for the NHS staff. We're not doing too bad here in Scotland, actually. Even with the tested positive and with the death, it's not as bad as that. At the moment, we have confirmed positive of 3,706 and deaths of 220, which is not too bad actually, but still we're observing the social distancing even when you go to the essential shopping of your supplies. You know, you can observe it is like 6 feet apart, and then people are advised to stay home. And well, at the moment, by the way, our chief medical officer has resigned.
Yes,
Dr.
that's
Catherine
true.
Calderwood.
Yes, yes.
She resigned because apparently she's at the forefront of the NHS here in Scotland to advise people to stay home, and yet she's the one who violated it by going to Fife, where she has a second.
A similar incident here
It's
happened.
a holiday home.
Yes.
Yeah, twice that she went there, and then because of the protest of the politicians and civilians alike, she has no choice but to resign because she did not walk her talk.
True.
She's the first who violated it.
Yeah.
Yeah.
I wish I had more time, Divina. I would like to talk to you some more, but I will talk to you some more maybe tomorrow and the coming days. To our Filipino brothers and sisters there in Scotland, we wish you all safety, continued health. Thank you for your sacrifice in these unprecedented and interesting times. We applaud you just as much over here in our country. Mabuhay po kayo. Maraming salamat sa inyo, Divina.
Thank you very much. I'm Divina Morales, correspondent here in Edinburgh, Scotland. We live in interesting times.
Indeed.
Thank you.
All right, and that's the news for tonight. I'm Alma Angeles. Join us online and here again tomorrow evening. From all of us here at Eagle News, thank you. We'll see you soon. We live in interesting times.
Thank you, Ka Divina.